Hello, everyone. My name is Colin Thompson. I am the Assistant Research Director of the Cost and Quality Academy. I'd like to welcome you to the Academy's virtual conference, Utilizing Real-Time Data Collection, a case study on actively improving nurse rounding. The slides for this conference were emailed to all registered attendees, and they can be accessed on our member web portal. Playback will be available on the Academy's website later today. Just to briefly review today's agenda, we're going to take a moment to do an organizational spotlight on our presenters today, view some industry insights, discuss challenges with rounding, discuss collecting and utilizing data, note some achievements at Centegra, and discuss moving forward. As noted on slide 3, you will have the opportunity to ask questions during the webinar by typing your questions in the space provided on the right-hand navigation. There will be a Q&A session at the conclusion of the conference. Once the conference is over, we value your feedback, so please take a moment to fill out the post-conference survey. If you should need assistance at any point during the webinar, please call the Academy at 888-700-5223 for personal attention. Again, that number is 888-700-5223. And as a note, today's program is being recorded. At this time, I'd like to introduce our speakers, Allison Rule from CipherHealth, Carrie Zbierski from Centegra Health, Jeannie Lariah from Centegra Health, McHenry, and Tricia Music from Centegra Health. Allison?
Hi, thank you, Colin. Hi, everyone. Thanks so much for joining today. So my name is Allison Rule, and I'm an account strategist at CipherHealth. For those of you that are not familiar with CipherHealth, we're a healthcare technology company located in New York City that was founded in 2009. Since then, our dedicated team has created tools to help our providers improve patient-centered care, increase their HCAP scores, reduce readmissions, and boost staff satisfaction. I would also like to welcome Centegra HealthSystem, whose acute care facilities are located in McHenry and Woodstock, Illinois, with another hospital coming soon down the pipeline. And their mission is to inspire and engage their community in their health and wellness. And they are at the forefront of innovation, and they take great pride in providing the best possible patient care. CipherHealth partnered with Centegra in October of 2013. At that time, everyone was actually focused on following up with their patients after they went home from the hospital to make sure that they didn't have any additional questions about their health or progress. And after seeing great results from that initiative, Centegra was striving for even more improvement and wanted to collect similar clinical and satisfaction information on patients while they were still in the hospital. So in April of 2014, we focused on rounding and capturing data through that rounding. So the folks you see pictured here will be speaking about their experiences on this topic at Centegra in a little bit, and I will introduce them in more detail shortly. So to get started, first I wanted to explain a little bit about what we'll be talking about today and why we believe this information is important to share with all of you. From working so closely with a group as great as Centegra, we have been able to demonstrate that using data during a process such as rounding can lead to an improvement in results on both the patient side as well as the staff side. So in order to dig deeper into why that is, we need to go over some of the challenges associated with rounding, why data collection is a pivotal part of a successful rounding initiative, and then the Centegra team will provide some examples of these practices that have led to their own team's improvements. Before we can start talking about rounding data, we have to acknowledge where the need for these numbers come from. We know that everyone is striving to reach the highest HCAP scores they can, which is enticing hospitals to get faster feedback on how their patients are feeling about their hospital stay. With real-time data reporting becoming more popular, pen and paper rounding is no longer realistic. A digital solution provides the best opportunities to not only meet these data collection goals, but exceed them. Improving these efficiencies associated with rounding can now mean saving hospitals money if they use this data in a way to improve patient satisfaction, achieve high ratings in these HCAP domains. Now that we've spoken to why we are looking so closely at data, we need to talk about why we are rounding on patients in the first place. Most use cases of rounding came from checking on patients' progress through their care in the hospital. However, in order to make sure that patient care is not just the bare minimum and that the patient is more involved with their care, rounding has evolved into much, much more. We aim to ask appropriate questions to patients that lead to identifying patient issues and providing speedy resolutions. We aim to improve patient satisfaction by asking what we can do to go above and beyond their expectations. We hope to identify which patients are at high risk for falls or negative outcomes so we can better prevent these incidences from happening again. And finally, we want to keep track of which of these issues are becoming trends so that we can work to improve those areas. So to instill this type of rounding culture in any institution, there are challenges. This includes having enough time to actually complete these rounds alongside providing proper patient care. And as we all know, nurses with all the other members of the hospital community are extremely busy. If they're able to minimize the time that they spend filling out paperwork or tracking their own steps, the more time they can spend actually with their patients. Without a rounding process in place, we may not be asking patients the same or meaningful questions, and this could lead to some patient questions going unanswered, and it presents challenges to staff for following up with those patients. Additionally, without a well-established rounding culture, an organization also has a lack of insight into what is actually being collected during these rounds. If consistency isn't maintained during rounding, it's much harder to identify areas of improvement. Finally, the challenge that we are going to speak the most on today is data collection from these rounds. Pen and paper, like I mentioned during this record keeping, is no longer sustainable with the amount of time it takes to input this information anywhere in order to use it effectively. And this double duty work does not allow for the best analysis of information that is collected. We have found that a digital rounding solution can help mitigate these hurdles, and Centegra will be providing some examples of this a little bit later on. So why do we care so much about this data and making sure we are collecting it in the best possible way? In short, the numbers are powerful. We're going to talk through some real-life examples of how impactful this data can be. Everyone is striving to provide the highest quality of care to their patients, and the information uncovered by this rounding is the way to accomplish this. If you are collecting and distributing this data in real time, service recovery becomes faster and more accurate. Improvement areas can not only be identified but supported by the data in order to promote change within the institution. And finally, workflow and processes within the hospital are inherently improved because communication and visibility become much, much easier. So with all of these rounding goals in mind, I'd like to turn it over to the experts. I have had the pleasure of working alongside some of the best caregivers in the business at Centegra HealthSystem, and a few of them are with us today. As Colin mentioned, we have Tricia Musich, the Director of Patient Care Services at Woodstock Hospital, Jeannie Lariah, Director of Patient Care Services at McHenry Hospital, and Carrie Zabierski, Assistant Director of Clinical Care at Woodstock Hospital. Together, they'll be sharing their experiences with instilling the importance of data collection during this rounding. So thank you all for joining us. And Tricia, would you like to introduce yourself first?
Sure. Hi. I'm Tricia Musich, and I am the Director of Patient Care Services over here at our Woodstock campus, as well as professional practice for the system. And I have my doctorate in nursing. I've been with Centegra for 25 years, and I've been using CipherHealth since we started it.
Good morning. My name is Jeannie Lariah. I am the Director of Patient Care Services for our McHenry site. Unlike Tricia, I don't have the longevity with Centegra Healthcare Systems. I did come from a different healthcare system that did not have the robust data collection that CipherHealth allows us to have here at Centegra. But I look forward to working with CipherHealth moving forward.
And I am Carrie Zabierski. I'm the Assistant Director of Critical Care Services at Woodstock. I've been with Centegra for 12 years, and I have been utilizing CipherHealth since its inception here at Centegra. So today, I think we wanted to start out just touching briefly on some of the challenges that we had with rounding prior to our partnership with CipherHealth. We were on a paper process, which, made it challenging collecting data that was real time, and we had a lot of variation between staff and management on how this rounding was being done. So we really wanted to partner with CipherHealth to enhance the process and work toward a data-driven solution. So we really wanted prompt issue resolution. That was a high priority for us with the paper rounding. It was very tedious to try to follow up with patients and their concerns. And with the CipherHealth, we were able to do that in real time and immediate for our patients. We wanted to be able to identify those issues immediately, have a quickly alert team members to resolve those issues for our patients, and make sure that they have a positive experience in the hospital. Prior to utilizing CipherHealth, we had relied primarily on our HCAP scores to uncover our areas of opportunity, but realized that, those scores are very much have a lag time, and that data is, a good few months old by the time you're receiving it. So we needed a way to look more frequently at our opportunity areas and to break those HCAP dimensions into more specific categories that we could tackle with some pointed tactics. So we didn't want rounding to feel like it was a responsibility just for the frontline staff. We really wanted to encourage and standardize rounding at all levels of the organization, including our nurse leaders. So to do this, we really needed that visibility into when and how rounds were being completed, and that added a layer of accountability among our staff and allowed our senior leaders to step in and offer support to the staff when it was needed. Finally, we really wanted to improve our HCAP scores and through rounding more consistently and more effectively on every patient. Partnering with CipherHealth and implementing Orchid digital rounding was really a great tool for us. Our partnership with CipherHealth allowed us to customize our rounding process to meet the goals that we were working towards. So we were able to standardize our questions that we were asking our patients across the system. So when everyone's asking the same questions, we were able to collect meaningful data and get a real in-depth understanding of our patient population. We were able to customize our rounding scripts to focus on specific patient issues or depending on what the unit was working on at that time. We were able to put through automatic alerts to ensure that our patients' issues were resolved quickly. This not only improved our patient experiences, but it also saved us time for the caregivers at the front line. If they noticed an issue requiring intervention, they could instantly send a message through Orchid to forward to the appropriate staff and know that it will be resolved quickly. That was a really great feature that we had with Orchid. Prior to that feature being built in, it could take several phone calls and then, going back to follow up to make sure that piece happened. With the Orchid, we were able to set up alerts that would, at the press of a button, it would immediately send a notification to EVS, to the kitchen, to POM, and it would come to their dashboard, and then they could follow up and close the issue on the dashboard so that closed that loop, and you knew that issue had been resolved for the patient. And the patients really thought it was quite amazing that we were able to, do that immediately and didn't have to leave the room to follow up for them. We also really wanted to have some robust analytics to take the patient information that we had gathered during rounds and create concise reports. So previously, with a paper process, that was all hand done, having to put things into spreadsheets if you were wanting to try to track trends. So we wanted to really make this process more efficient and give time back to the leaders rather than having them do that paperwork. So rounding is really a focus across our entire healthcare organization, so being able to share that information across care teams and provide our staff with the visibility of rounding was really important to us. And Orchid and CipherHealth really helped us achieve that. Data-driven practices are really, best practice in nursing. I think that we can all, speak to that. Each stage of the rounding process, it's really important. We want to capture data to identify our areas of opportunity. And with the reports that Orchid was able to provide, we could hone in on certain areas and then strategize to make improvements on our care delivery. One opportunity that we recognized and that they were able to tailor for us was working on targeting hourly rounding and call light response. And so they were able to put in a key question for us that asked specifically about hourly rounding and the use of call lights and what patients were needing to use their call lights for, so that we could really drill down into that data to see where the opportunities lied with our staff with hourly rounding. We are consistently reviewing our reports to track progress and to support our initiatives. Rounding isn't just about improving the patient's experience in the here and now, but it's about ensuring long-term system-level improvements. The organization has worked with CipherHealth to review reports and develop a game plan. Using our HCAP scores, we were able to pinpoint specific opportunity areas, and we found that quiet and communication about meds were areas that we had a lot of potential improvement for. So with this information, we worked with Orchid to customize our scripts in these areas and tailor our questions to hone in on those dimensions. Even though it seemed a bit counterintuitive, we found that the units identifying the most opportunity areas were also typically scoring the highest on the HCAP survey. That was really kind of interesting when looking at the data to see those people that were finding the most opportunities during the rounds, but then meeting those needs immediately, were actually seeing higher HCAP scores than other units that were not identifying as many opportunities during their rounds. This information was able to let us know that by proactively identifying those opportunities and issues that we could resolve them quickly to create a positive patient experience. And in fact, some patients, were so impressed with that issue resolution that it improved their overall feeling toward their experience here at Centegra. So when issues go unnoticed or patients don't feel like they can voice their concerns, this ends up hurting us on our HCAP scores later on the back end. At Centegra, we find that the units that are rounding on the largest percentage of patients are seeing the highest HCAPS results. So although our staff knows that rounding is important, it's helpful to have this data to support our efforts for rounding and to encourage our staff to round on patients consistently. So, really kind of drove home that leader rounding was certainly something that positively impacted our HCAP scores, and we had data behind it to prove it. Our improvements and achievements with rounding are certainly reflected by our HCAP scores, but they're also acknowledged by our patients. As you can see by some of these comments here from our patients, I was so happy with my care. I received excellent service and filled out a DAISY nomination for the entire staff. Everyone offered their support and asked what they could do. Every single person has been excellent, from ICU to telemetry, including the CV doctor and his team. I've had an excellent patient care. Since enhancing our rounding process, we've received a lot of positive feedback from patients about our staff's level of responsiveness and the quality of care that we are able to deliver. And I think it just really that presence of leadership on the unit and follow-up in real time, just really shows our staff that we're there to support them and support quality patient care on the units. Each week, our staff does come together to evaluate our data and rounding activity. One thing that this allows us to do is praise our team members for the good job that they do. So we want to make sure that every member of our staff feels empowered and well-equipped to round on each patient and successfully resolve issues. We also use these evaluations as a time to track our progress and identify any new arising opportunities. This allows us to go back and make necessary changes to the rounding process and develop purposeful plans moving forward. Having data to draw upon eliminates any sense of guess and check in our work, and we go into the patient's room with a purpose and strategy and collect information that we know will be useful for the entire organization. So it really had also, helped us to give that time back to give structure around those rounds. By capturing and analyzing meaningful data with Orchid, we've been able to improve service recovery and ensure that our patients leave the hospital with all issues resolved and questions addressed. Moving forward, we really want to increase rounding activity across all the units and identify more issues during rounds. Discharging units should prioritize patients who have not received a round. So generally when walking onto the unit, making sure to prioritize those patients who have not received a round yet or will be discharged that day, so that you can really, hit them, making sure that you have at least one round on a patient while they're here, and then making sure that be that last interaction before they go home. We plan to use Orchid to get live alerting in even more of our ancillary departments. So while we have this capability in some of the departments, more involvement across the organization will just continue to improve that responsiveness to our patients' needs. And we'll continue to work with CipherHealth to improve our services and understand how we can continue to progress. It's been a really great relationship. And I just want to thank the Academy, for letting us present today.
It's our pleasure. Thank you for a wonderful presentation. At this point, we would like to begin the question and answer session. To ask a question during this session, as you have done throughout the presentation, please type your question in the space provided. This will place your question in our queue. While we're getting people into the queue, we'd like to ask a few pre-submitted questions. The first of which is, what have been some of the biggest successes that you've noted since launching the Orchid rounding program?
Some of the biggest successes that we've had is really initially was just getting more rounds on our patients. That was a huge success for us to take our percentage of patients that were being rounded on a daily basis from well below what our goal was to actually exceeding our goal, which certainly had a positive impact on our patients' perception of their care, our staff's feeling of support from their leadership, and our HCAHPS scores. So that was really, the first big win for us. And then I think really just being able to tailor those questions to target those areas that we have identified as opportunities to delve deeper and get better data so that we can improve, improve our outcomes.
Excellent. Another question. Does the rounding tool provide customizable or tailored reporting options to support specific hospital initiatives?
I can take that question. This is Allie from CipherHealth. Just to mention that I often am creating tailored, customized reports for Centegra and for all clients, we know that not everybody is focused on the same thing. So of course we have, our reports that we send on a regular basis, either weekly or monthly, that are pretty standardized, but we know that there may be specific meetings where you're trying to achieve specific goals and want to look at the data a little bit differently. So we offer a wide range of customized reports, and if there's anything specific that you want to look at any particular time, we are always amenable to those reporting requests.
I would just like to say on the Centegra side, as far as the reports, it's been a great process. It really is a matter of an email over to CipherHealth just stating, we were looking at this, can you pull a report? Our newest initiative that we were looking at with the call light, we got our first report, and then when we looked at it, we're like, could we tailor this a little different? And so we changed the way we were doing the rounding tool. That was changed within 3 days of making sure that our associates knew that we were changing it. And the report that came over, the first report was like, okay, how about looking at it this way? And really it was within 4 hours that we now have a report that we will present to the staff to then look at how best that data can be used and which report will work best for the end user. So it is it's a very easy process with getting those reports.
Excellent. Another question. What is it like to round with an iPad or tablet, and how has it changed rounding?
Certainly there was some hesitation at first to have that device because it felt unnatural in nursing to have that device kind of between you and the patient. But I will say that it was something that people, have grown to really appreciate. It helps keep you on task in the round. Patients actually, are pretty impressed that we have that technology, especially able to send those alerts in real time from the device. And it actually helped, focus and shorten the length of time that it took to do our rounds.
Excellent. Another question. How much time do these rounds typically take per patient?
Well, I think prior to utilizing the Orchid rounding tool, round per patient, some leaders were reporting took on average 10 minutes. With this tool, we've seen that average go down to about 3 minutes. Certainly there are times when you have, a concern from a patient that's going to take you a little bit longer, but on average about 3 minutes per patient.
Excellent. Can you share with us some of the questions you asked during the rounding process?
Certainly. We ask, how the patient feels about their experience overall in the hospital. We ask about our call light response, about whether they've had to use their call light in the last 24 hours, and if so, what for, and was the response quick. We do ask about whether it was quiet enough for them to rest. Really things that kind of link up with our HCAHPS domains.
Excellent. Another question. Is this tool used solely for HCAHPS rounding, or can you customize surveys to monitor compliance for performance improvements projects such as CAUTI or CLABSI bundles?
I can answer that question, Allie from CipherHealth. The majority of the rounding that is happening at Centegra is patient-centered and asks mainly patient experience and service recovery questions. However, we've expanded Orchid to be able to be used in any use case for rounding across the whole facility. So we, of course, do it for CAUTI and CLABSI rounding, for EBS staff to round on their patients, to do unit rounding, to monitor patient safety, to do Joint Commission readiness rounds. You name it, we've thought of the use case and are using it somewhere to just make sure that even the staff members are being rounded on. And so there's really no limit to the rounds that can be done within the tool.
Excellent. Another question, can you describe specifically your rounding process in such as who actually rounds and how often it's done?
Certainly. We do rounding every day on every unit. Our goal is every patient, every day. It's split between the leaders of the unit, so the primary person responsible would be the unit leader, and then those leaders that have a large scope then also share some of that responsibility with their charge nurses.
Excellent. Another question, how do you distribute or communicate your data and findings to frontline staff?
Well, it's really important to give that feedback in real time. So while we're rounding, we're certainly giving feedback to the staff right there in real time. But we also will send out kind of a summary at the end of the week to let the staff know kind of the overall trends on the unit and make sure that we publicly recognize any of those staff that were mentioned positively by a patient. And that really helps keep the staff engaged and understand that, we are there supporting them and helping to promote quality patient care on the units.
Excellent. Another question, when the rounding is being done and the information is gathered, is that information entered in front of the patient, or do you wait until you're outside of the room to enter that information?
We enter that information right in front of the patient as we're going. The tool is very easy to use, so it's not hard to go ahead and type that information in while you're there with the patient.
Okay, another question. Have you seen an improvement in your HCAP scores?
Yes, actually in nurse communication, communication about medication, that's been one of the questions that we've had on our Orchid rounding tool since its inception, and we've definitely seen an improvement. That's one of the questions that we have definitely changed over the time. So we were asking about the new medications, any type of medication, if they're getting education about it. And then as we've watched the scores, we've definitely changed the tool to go along with those questions.
Another question, how did you train your staff to round with the tool?
On the CipherHealth side, I would just like to mention first for training is that we always, when we're introducing Orchid into any of our hospitals or facilities, we will always come on site for training. And it's usually twofold. We like to get a sense of the rounding culture that's already established within the facility and just kind of do some shadowing rounds to get a feel. And then also coming in, introducing all of the staff members who will be using it, and then continuing another set of shadowing to make sure that they feel comfortable with the tool. As mentioned earlier, it's always a little bit of a learning curve when introducing a new piece of technology, especially an iPad, into something such as nurse leader rounding. So we always want to make sure that everybody feels comfortable and that they're introducing the tool to the patient as they're using it so that, the patient understands why they're recording this information on an iPad and how it will be used to better their patient satisfaction. But we always come on anytime a new facility is introduced to make sure that we're on site during the whole process of the inception of Orchid.
I think on the Centegra side as well, CipherHealth has been great, especially when we were first started, and then as we've had, new leaders or charge nurses that we've trained. But also I think that it's just important to know that it is different to walk in with an iPad for the nursing staff as well as the leaders when first doing it, or even when we have new leaders coming on, and really just pairing somebody who's comfortable with it and who has done it with a new leader. And it's really just a matter of one-time rounding, and everybody's been pretty comfortable going in and moving on with it. So it is an easy process to do that.
Excellent. Well, at this point, I'd like to thank both CipherHealth and Centegra for a wonderful presentation, and I'd like to thank everyone for attending the virtual conference, Utilizing Real-Time Data Collection with CipherHealth, a case study on actively improving nurse rounding. Once again, the Academy is available for further questions on the materials presented today by calling 888-700-5223. Thank you, and stay tuned for our next virtual conference, which we will announce in the near future. Please disconnect your phone lines.